At the recent Food Congress, a lecture by the renowned cardiologist Clemens von Schacky attracted considerable attention. His basic tenet was simple. We know that omega-3 has a preventative effect on cardiovascular accidents, and yet most intervention studies have been disappointing, and the German professor has discovered the cause of the problem.
The way the intervention studies were done was people were given a fixed dose of omega-3 fatty acids, and other people were not, and at the end, after a year or after 5 years, events were compared. And that was not very convincing, especially not in the last few years. Now, this, we thought, calls for a change in perspective. So we did not focus on intake, but we focused on levels. And if you focus on levels, it falls into place.
And it's true. The studies in which von Schacky focuses on omega-3 blood values produce unambiguous results.
There's a very strong relation between omega-3 blood levels and cardiovascular death. The lower the levels are, the more likely, for instance, sudden cardiac death is.
And then there is, of course, the crucial question. What are the ideal blood values?
Currently, we say the level should be between 8 and 11% of the fatty acids in the red cell membrane. The reason for that is that it does not seem that there is much of an improvement beyond 11, and risk starts to increase below 8. So that seems to be a good zone for cardiology.
That's ideal, but we will still have a long way to go. In Belgium and Germany, the score is around 6. A country like Saudi Arabia with a high incidence of heart infraction is around 4. But in Japan, they're doing really well, between 8 and 11. Fatal heart value is 20 times less than there are in our countries.
The take-home message for me is, if you want to reduce, as an individual, if you want to reduce your cardiovascular risk, you better get your omega-3 index between 8 and 11. The take-home message as a scientist would be, we're going to focus on this problem, change the perspective from looking at intake at looking at levels.
A nod is as good as a wink. As a dietitian or doctor, it makes sense to have your patient's omega-3 blood values checked.